The trapezius will lead to back of head pain, back of neck pain, headaches or migraines, mid-thoracic back pain, problems holding the arms up, pain in the rotator cuff, temple and eyebrow, temporal headaches, TMJ issues, and upper back pain. The first thing you're going to do is locate the trigger point. Gently palpate along the muscle to locate the tender spot or tight band of tissue. A trigger point is usually going to be felt as a small, tight knot that's tender when pressed and may produce referred pain. In this case, usually in a question mark pattern around the ear into the front and top of the head. Once you've done that, apply a direct pressure using your thumb, fingers, or a soft tip tool, and you want it to be gentle and sustained pressure. Start with light pressure and then gradually increase as tolerated. The goal is to reach a moderate level of discomfort without causing pain. Hold the pressure on the trigger point for 20 to 60 seconds or until the client feels like the referral pain is going down. Ensure the client is comfortable and then release and repeat if needed. After you've done that, what you can do is stretch the muscle. So with the upper traps, you're going to pull the shoulder down, get them to bring their nose to their opposite armpit, and then create a stretch in the upper trapezius muscle. You can hold this for 20 to 30 seconds, and you want to make sure to encourage deep breathing during this process with slow, deep breaths, especially if they're releasing a bit of pain in this sensitive area. Afterwards, you can do a little bit of effleurage, and you want to make sure to limit trigger point release to 1 to 2 times per week. The sternocleidomastoid primarily has trigger points that are going to be back of head pain, chest pain like sinusitis, dizziness, blurry vision, dry cough, ear pain, earaches and tinnitus ringing in the ear, front of chest pain, frontal headaches, migraines, sore throat, temple, and eyebrow pain. To locate an SCM trigger point, get the client to rotate their head to the side and press up into your hand. Now, tell them to relax slightly, and with a pincer grip, you're going to palpate along the entirety of the muscle. Usually, you're going to find a trigger point in the kind of bulk of the muscle there. Get them to turn their head back to neutral, chin in, and then get them to relax. Now, hold the trigger point for 20 to 60 seconds. You can either use the pincer grip or 2 fingertips, depending on what's more comfortable for you as a practitioner. Once the muscle's released and the referral's gone down, slowly release the trigger point. Turn the head to the side into rotation. Place your hand around the ear like that, and then stabilize at the clavicle and just pull back slightly, creating a stretch in that muscle. Scalene trigger points are going to lead to back of arm, dorsal finger, front of arm, front of chest, front of shoulder, mid-back, and upper back pain. You can also get painful weak grip and thumb and radial hand pain. To locate the anterior scalene, get the client to rotate their head and pop up that large SCM muscle. Then you're going to take 1 or 2 fingertips and you're going to slide just posterior to that muscle. To let you know that you're on it, you can get the client to take a nice deep breath in, and you should feel the muscle move slightly. If it's really adhered, sometimes it's not really going to move, but you'll feel kind of this crunchy, tiny, kind of slender muscle under your fingertip. Hold this for 20 to 60 seconds until the referral starts to die down. Make sure the client is really relaxing their neck into this because this can be a bit of a contentious spot to be on. Now, once the muscle relaxes and the referral goes down, you can slowly slide your fingertip out of that area, get the client to take a nice deep breath in and out, and then you could do a general stretch for all of the scalenes. So you're going to get them to do lateral flexion towards the opposite shoulder, and then you can do just a slight rotation to stretch the anterior scalene. Once you've done that for 30 to 60 seconds, bring the client back to neutral. The levator scapula will lead to back of shoulder pain, problems holding the arms up, a stiff neck, and upper thoracic upper back pain. To find the trigger point in this muscle, turn the head to the side and then palpate along the side of the neck, going into the top of the shoulder near the scapula. Now you can use your thumbs, fingertips, whatever you feel is comfortable. Palpate down, and then usually the most common trigger point for this muscle is going to be near the superior angle of the scapula, just off the attachment site of the muscle. Once you find it, you can use a fingertip or whatever you prefer, and then bring the client back to neutral. Now hold this trigger point 20 to 60 seconds. Allow it to melt, relax under your fingertip. Communicate with the client. And if you find that the trigger point isn't releasing, the referral's not going away, you can do more of a positional release where you shorten the muscle by bringing their head in towards where your fingertip is. This will shorten, slacken the muscle, and allow the referral pain to go down. After you've done that, you can stretch the muscle by bringing their nose to their opposite armpit. Hold this for 30 to 60 seconds. The suboccipitals will lead to primary symptoms of headaches and migraines, and secondary symptoms of back of head pain, headaches around the entire head, temple and eyebrow pain, and temporal headaches. For the tiny suboccipitals, you're going to find the ear, and then there's going to be a bone just underneath the ear, the mastoid process. Then you're just going to slide your hands even further down the base of the neck in the occipital ridge, which is the base of the skull. And usually here you can just use 3 fingertips and just palpate, press in those areas, and see where the client or person is having some sort of referral pain. Usually it's going to be into the ear, into the eye, or down the neck and into the shoulder. Hold this for 20 to 60 seconds, and you could even bring them back to neutral just to relax the neck even more so. Communicate with them, tell them, relax the muscles. And then if the trigger point still doesn't release, you can do a positional release where you shorten the muscle into your fingertips by bringing their neck back into extension slightly. After you've done the trigger point release and the referral's gone down, you can stretch the muscle by lifting the skull and bringing their head into flexion, their chin towards their chest. You can hold that for 30 seconds, or you can just manually stretch the tissue yourself by placing your 3 fingertips in the occipital ridge in the base of the skull and pulling the tissue slightly to stretch it. The Splenius capitis will lead to headache or migraine pain, eye pain, top of head pain, and shoulder pain. I'm going to show you guys with the client in seated how to find the Splenius capitis muscle. So you're going to take your fingers and you're just going to go below the occipital bone and right beside the cervical spine, and you're going to gently press in and down towards the muscle layers beneath the trapezius. The Splenius capitis lies underneath, so you may need to press past the superficial layers. Apply a slow side-to-side pressure to differentiate between the muscles and hold the trigger point for 30 to 60 seconds. Now, this technique is actually a little bit easier with the client on their back. So you can just slide underneath the occipital ridge, right beside the cervical spine, and allow the weight of their head to allow your fingers to rest into that muscle. Hold this trigger point, communicate with the client. If it doesn't release, you can get them to go back into a little bit more extension with their neck and also rotation. Encourage some deep breaths if the muscle isn't releasing, and then wait for the client to tell you that it's relaxed. Semispinalis capitis trigger points will lead to headaches or migraines, and also back of head pain, frontal headaches, and temporal headaches. I'm going to show you guys how to find this muscle with the client in seated. Begin by palpating just beside the cervical spine, moving upward towards the base of the skull. Apply a gentle pressure as you palpate beneath the more superficial muscles, like the trapezius and the Splenius capitis, to reach even deeper into this semispinalis capitis muscle. Use your fingers to feel for taut bands or rope-like sections along this muscle path, and the trigger points are usually going to be in the top half of this muscle. With the client lying down, it's even easier to use the weight of their head to gently, slowly slide in deeper to find the referral pain. If you find referral pain here, it can oftentimes be really sensitive and tender for clients because you're in there quite deep. So get them to take a nice deep breath in and out to relax this muscle. Once it's relaxed, then you can do a nice stretch. So place your arm underneath the neck and then your other arm underneath your other arm, and use your hands to press the shoulders down and lift off, doing a squat to flex the neck, and that will create a nice stretch in the back of the neck. You don't want to do too little or too much here, so communicate to make sure that this is feeling like a nice stretch that's not too much. And then once you've done that for about 60 seconds, you can slowly release the neck back down and allow the client to relax.